Welcome to LiveWell Talk on the Mailbag. The Mailbag is a segment of the podcast where we answer questions from listeners on various medical topics. And today's edition of the Mailbag will cover topics related to nutrition, pregnancy, and more. The first question is from Jacob. How important nutrition is to health outside of weight loss or gain, particularly chronic conditions such as Parkinson's disease, certain cancers, and heart health? Nutrition is incredibly important. And as physicians, we get about 2 weeks of exposure to nutrition in medical school. And a lot of it is more biochemistry and caloric calculations. And we do not get the practical training that we need. I think most physicians understand that and get it on their own as they get into practice. But nutrition is important. And particularly with chronic medical conditions, malnourishment from a chronic medical condition can lead to a protein calorie deficit that is only amplified or makes that patient much more susceptible to illness when they have an acute illness like a pneumonia and they're protein malnourished at baseline. I think a good demonstration of how deficiencies, whether it's vitamins, can affect illness and break down the body. The Franklin expedition, I read a book about that once, and that's where they were trying to find the Northwest Passage and got froze. In the journals, these sailors that were stalled in the winter developed scurvy, vitamin C deficiency, and old scars that were like 20 years old would break open. So it gives you a good example of what will happen if you have nutritional breakdown and compromise. We see that particularly in wound healing out in the wound center. Malnourishment leads to wounds that are slow to heal or difficult to heal. And supporting ongoing nutrition is important. The processed foods we have now, the refined foods, maybe we lose a lot of that. And good, well-balanced nutrition is extremely important to health. You are what you eat, I believe, was what the old saying used to be, and I can't stress that enough. And also, we know that the microbiome, Dr. Abramson, when he met with us, we discussed the microbiome, the gut bacteria that nutrition will influence, and how that can influence health. And that is a new study in medicine and revealing answers to questions that have long been present, and more to come on that. Good question. The next question is from Sierra. How accurate are pregnancy tests? Should I take one at a physician's office or at home? The answer is yes to both of that. I mean, so pregnancy test at home, they'll claim a 99% accuracy. I think the thing to keep in mind is if you missed the menstrual cycle, a period's been delayed for at least 1 week, you do the home pregnancy test. Now, some medications can interfere with that. I think like human fertility agents can give because it contains human growth hormone, and so not human growth, gonadotropins to help with fertility, and that can interfere with the test. If you think you might be pregnant and it's negative, I would repeat it in a week and see if it changes, because it may be too early and just not sensitive enough. And then pregnancy test should be confirmed with an appointment with the physician in their clinic. So that's a good question, one that I'm sure many people contemplate at times. And also, a home pregnancy test, pretty straightforward, but there's always technical issues as far as performing the test that may impair its accuracy as well. Last question today is from Ashley. With the spike in flu cases this spring and summer due to decline in natural immunity, what is the current flu situation? The current flu situation is, I will tell you exactly because I just looked at the numbers a little bit ago. From February 20th to February 26th, we had 200 cases of influenza A. That's the most recent data I have. The new data will come out on Monday of next week or over the weekend. So we have about 200 cases. Remember, last year we had 0. COVID competed with that. And that goes back to one of the things we've said on some of the COVID-19 podcasts, that you can't really compare influenza with COVID-19. They behave differently. And last year with the masking and the shutdown, COVID-19 was persistent, of course, but influenza went away. And so that more to come on that. But yeah, we're about 200 cases, and that's up maybe a dozen or so from the week before. And we'll continue to follow that. They've all been influenza A in our lab. Influenza type B, there's only been one or two cases, single digits for sure. In regards to influenza, we're getting towards the end of the flu season, March into April. But last year we saw RSV show up in July, where normally it's like September. So will we see persistent flu into the spring and summer? Hard to say, but we'll continue to follow that. And that's all for the mailbag today. If you'd like to submit a question to the mailbag, go to unitypoint.org/mailbag, common spelling of mailbag, MAILBAG. I'll answer questions about COVID-19 and other technologies or follow up to previous podcast. It is not a replacement for your personal physician. If you have a personal health issue, you should contact your physician to discuss. If it's an emergency situation and there's no available emergency room nearby, then dial 911 for emergency services. Otherwise, present to the emergency room. Once again, you can submit your questions to me at unitypoint.org/mailbag. That's unitypoint.org/mailbag. I look forward to hearing from you, our amazing listeners.
Thank you for listening to LiveWell Talk On. If you enjoyed this episode, don't forget to subscribe. And if you want to spread the word, please give us a 5-star review and tell your family, friends, neighbors, strangers about our podcast. We're available on Apple Podcasts, Spotify, Pandora, or wherever you get your podcast. Until next time, be well.